I'm going to be doing an intramuscular injection into the deltoid. And so the first thing I'm going to do is check my orders and make sure I have an order for it. And then on my orders here, it looks like I have an order for 1 milliliter. And I'm going to check the MAR and make sure it matches. Make sure I have the right patient here. Looks like I do. So I'm going to go and get my medication. I'm going to wash my hands. I'm going to check the vial. And the vial, I'm going to make sure that there's no breaks or cracks in there. Once I do, I'm going to clear this off with some alcohol. I'm going to use a 3 milliliter needle and a 5/8 25 gauge needle. I'm going to draw up my 1 milliliter of air, insert it into my vial, and then I'm going to pull out a milliliter of medication. If I have some bubbles in there, I can kind of just tap them out. Looks like I got them all out, so I'm going to pull out my needle, recap it. Once I recap this needle, I'm going to actually change it. And I'm going to discard that in my sharps, put on a new needle. I'm going to double check this and make sure I have the right amount of medication, the right kind, and I'm giving it at the right time. I'm going to go down to my patient's room. I'm going to check with them, talk with them, see if they have any allergies, educate them on what we're going to do, and then I'm going to locate the deltoid injection site so that we can give this in the proper site. So I'm going to have them pull up their sleeve here, feel for the accruing process here, put 2 fingers below, and kind of make an upside down V here. And this is going to be the site where I'm going to inject this. So I'm going to take my alcohol swab, clear it off here, wash my hands and put on my gloves while I'm waiting for that to dry. I'm going to check my medication one last time before I give it. Looks like I have the right amount, so I'm going to uncap my needle here. I'm going to hold on the sides here, kind of, and I'm going to inject at a 90-degree angle. I'm going to slowly put the medication in. And once I have this medication in, I'm going to pull out my needle. I'm going to recap it. And once I have that recapped, I'm going to discard of it in the sharps container. I have some gauze. I can hold the site there if there's a little bit of blood. Put a little bit of pressure there. Once I'm done with that, I'm going to see if the patient needs anything else. If not, I'm going to step out. I'm going to go and I'm going to chart the dose that was given, the medication, the patient, how they tolerated it, and the site that it was given in.